episode 73 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and reverse diabetes coach, which is also the name of my website. I see clients in person and remotely, and am accepting a limited number of clients in February. You can reach me using my contact form on my website or just use Christine@reversediabetescoach.com. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. So I want to explain to listeners that, especially my faithful, loyal listeners, that you may have noticed there was an episode I missed last Thursday. Today's February 2nd, and I have done weekly episodes for the podcast since I started over a year ago, but I had to miss one, much to my dismay, because I broke my left wrist. And I will tell you the story of what happened, how it happened, and share some lessons learned, because there are all sorts of interesting things that I've learned in this process, from resetting my wrist to ending up needing surgery and a plate and screws put in, to medication and some side effects of medication, and also having your blood pressure go up as a result of pain, and even taking NSAIDS, which I'll explain, and even what vitamin C does in terms of tissue healing. So I'm not going to go into a lot of depth the way I usually do this time, but I plan to give you an update next week and delve a little bit further into the research on some of these issues. So I'm a firm believer in the who, what, when, where, and where, the 5 W's. So I'm going to just tell you first what happened. I went ice skating at an indoor rink near me. It's part of a recreation center. And I was really pleased because I'm a very active person, and I firmly believe, you would hope, right, for a nutritionist, in staying in shape. So I am physically doing something every day for about an hour, and I usually go use the pool there. I had actually bought a 4-month pass, and I could bring guests too. So I had originally invited my niece, who's 17, very close to her, to come swimming with me. We call it a spa day, and then we hit the whirlpool and the sauna, which is lovely. But I think she was a little bored with that, so I mentioned ice skating, realizing that I hadn't ice skated in a while, but I do know the basics, right, of ice skating. So she seemed to really like that idea, and of course, being the good aunt, I wanted to please her. So that's the backstory in terms of how we ended up ice skating on January 22nd. And we went for a nice lunch, and I treated her, and then we headed over there. Well, one of the first things I noticed was they rent hockey skates out. I've never seen skates so big. I admit I have big feet. I mean, like size 10. All right, I put it out there. But even, my shoe width is nothing, is not normally like twice, the hockey skates were like twice the width of my normal foot. So I thought they were really big and bulky, but what the heck. So I laced them up, and then they seemed to get loose, and I relaced them, and my feet were not 100% comfortable with them. For all you people out there who may go ice skating, you may be able to relate to this. But I just, I gave it a little time, and then I felt like, okay. And then I felt it seemed to dissipate or disappear, and then I started getting my groove, going around the rink and several times, and it's not a really large rink. And then even, remembering how to do some turns, and I'm feeling pretty good. And then I kind of slow down and kind of look over to see where my niece is, and of all things, that's when I lose my balance. I don't know if it was a combination of the skates, and I hit a little uneven patch. I wasn't going fast at all. But in that split second, I could tell I was going to fall. And I looked to see if I was near the railing, which they have going around the perimeter. And unfortunately, I realized I was too far away to grab hold with my right hand, which would have probably maybe sprained my wrist, but not broke it. So instead, I had to put my left hand out, and I went down very hard. And the minute my hand, my wrist hit the ice, I knew I broke it. It was just it was really painful. Ice is very unforgiving. So I knew then it was not going to be good. And these young guys who monitor the ring came over, and other people gathered around, wanted to know if I was okay, and I immediately said no. Basically, I need help now. And so they got me off the rink, and then I wanted to share with you that what helped me not pass out, because I'm fortunate that nothing like this has ever happened to me. I mean, the worst thing that's ever happened to me as far as breaking bones has been in high school when I took Taekwondo, and I was sparring with a friend of mine who got aggressive, and I went to defend myself, and we both hit our toes at the same time. That was my big toe, but it wasn't like my wrist or arm. So anyway, one thing that really helped me from not passing out, because I really looked bad, and it was my niece reminded me that I know meditation. I had gone to my meditation meetup group that morning. I do practice meditation almost daily, and I was able to get into that mindset where I had been similar to that morning, just focusing on my breathing, and it really calmed me down, and it just kept my mental focus on that and on my breath instead of the pain. And so I was able to stay conscious until the medics arrived. I mean, I stayed conscious anyway throughout the whole time, because they would not give me any pain relief. I didn't even have aspirin handy. And that's really what you're thinking about, of course, when something like this happens. But to be fair, the medics don't want them to give anything. So I was very happy when the medics came, because I knew they could start giving me a little bit, an IV, some pain relief in the IV. And then when they took me to the ER, it was hard because they wanted to take x-rays before, giving me any real morphine or anything. And they want you to be alert so you can work with the x-ray tech to position your arm in different ways. So they get all 5 different angles. And believe me, when you've got something broken, it's not fun. But they're doing their job, and you want to cooperate. So I did. And then it showed that I have what's called a Cole's fracture. It's named after, I believe, a Dr. Cole, Colle, and it's a fracture of the distal radius. And the distal radius runs down the forearm, around sort of near the thumb section of your forearm. So that's what they determined through the x-rays. And they also there was some deformity there. Things had really shifted around. So what they wanted to try was called a reset. I never heard of this, but it's called a closed stress reduction. So I'm all for non-invasive procedures. I always believe that you should try the least invasive option first. So rather than surgery, I was definitely up for trying this. So I was fortunate too, there was an orthopedic specialist available at the hospital on call, and he came and determined, did it. It was really unusual. They had to give me a local anesthetic right into the bone of my left wrist, which felt like just enormous pressure, but I wanted this to give it a try. So then he did this kind of yanking, and I don't know quite, he had his leveraged his body against my left side, and and did this kind of very manipulative, all I could think of was the chiropractor, but that's not exactly accurate. But it's a manipulation, using his pressure to realign the joints and the bones in my wrists, so, which were very lopsided. So he did it, and they x-rayed it again, and it looked really good. The nurse was super optimistic and said, and 95% of the time when we do this procedure and we do a post-op, post-procedure x-ray, you don't need surgery. So I was ecstatic. I'm like, yay, this is great. I thought I was done. And they had given me morphine, and, it was, my sister-in-law and brother had come down in the meantime, my niece's parents. So they drove me home, and I needed to be on pain meds. So let me talk briefly about pain medication. I was put on oxycodone because even though they had given me a local anesthetic because they wanted me to be alert enough to, for the x-rays, as I mentioned, and then this procedure, you're going to be in a lot of pain. And so, but you have to be careful. Oxycodone is a narcotic. It's an opioid. So the doctor had prescribed 2 of those every 4 hours. And I luckily just took 1, and I was out. I mean, it just, for me, it may be a very individual thing, but it really puts me to sleep. So one thing I learned very quickly was not to take too many of those. Even though I knew the first day would be the hardest, after taking 2 or 3, one at a time, but 2 or 3 in a row, one at a time consecutively, so I took up to 3 the first day, I was feeling really loopy, and it was kind of playing with my head a little bit, so I just stopped it. And then I took Motrin, which is an NSAID, or non-steroidal anti-inflammatory drug. And so anti-inflammatory made sense too, because frankly, for those of you who've been in a cast, you'll know what I'm talking about. But your hand or whatever part of your body is usually swollen from all this. It's bruised in the beginning. It's black and blue. And in my case, my fingers have been swollen for days now. So, anti-inflammatory, I thought, good, it'd help reduce that, But the other thing, so I scaled back on the the oxycodone. I realized if I was going to function and be alert at all during the day, I could not take it during the day. So that's what I've done. I've limited myself to taking it. It takes about 30 to 40 minutes to kick in, so I take it 30 minutes before I know I'm going to go to bed. And then I sleep really well. I sleep through the night most nights. And but it can make you a bit groggy too in the morning. So I find, frankly, I'm drinking some coffee, but also to give myself a little more time. I don't schedule anything where I have to do work at 9 o'clock, 8 o'clock even in the morning, because I'm just not there yet mentally. The other thing I learned, so I take the NSAIDs, in this case Motrin, to cope with the pain and the soreness. I'm taking just 2 in the morning and 2 in the afternoon. But other thing that is kind of a side effect of all this is that my blood pressure had gone really up. It's not unusual in sort of a trauma situation or stress, which is stressful on your body. Obviously, you broke something, it's stressful. So your body reacts often by, your adrenaline pumping and other things. So what was interesting to me was my blood pressure went down quite a bit. They were worried. The medics were worried. It would drop to 76. And then it went way back up to 176. And when I came back for the surgery, about 5 days later, it was still high. It was 100, around the same. But then it also dropped. When they gave me the anesthetic, they gave me a nerve block for the surgery on my they put it into my left neck, and it numbed the entire left arm, which is where I had the operation, the surgery. So by the time I left, it was back to, you always want your systolic, which is the upper number, to be 100, like between 110 and 120 is ideal. And the diastolic number, which is the second number, usually to be around 80, 85. So my numbers were good when I left, but I had a feeling they still might be a bit high. So I had a friend who's a nurse come over and bring her machine, her blood pressure digital machine, which is much better than the kind that I had in my nutrition training. And so she took it yesterday, and it was 159/95, which is, just to put in perspective, my normal blood pressure is 112/80. So that, it has been much higher than usual, especially yesterday. So I weighed whether to get on some medication, but the other interesting thing was I had not done really any meditation except for that first day when this happened at the ice skating rink, as I mentioned earlier, to kind of push through passing out. And I know that that really does work. And if you go back and listen to an episode I've done on meditation with Dawe Gocha, who's a Buddhist monk, we talk about the research behind all this. So I decided, okay, I need to get back. I usually spend about 30 minutes doing some Buddhist chanting, prayers basically, and then I meditate for a good, at least 10 minutes afterwards. So I just did that this morning. I had bought the same blood pressure cuff and machine that my friend had, a good one. The brand is Omron, Omron. And lo and behold, my blood pressure today was between 133 and 145 on the top number, and it dropped to 94, 95 on the lower number. That's still higher than I would like, but the fact it went from 159 to around 143, and then even I took it one other time today and it was even as low as 133 on the top, on the systolic number, was amazing. So it dropped a minimum of 15 points in one day. So I'm pretty confident that my goal is to just keep doing what I'm doing, the Buddhist chanting and the meditation, and see if it will keep dropping like 15 points per day. And then by the weekend, today's Thursday here in Washington, D.C., it should drop to what normal is, around at least 120. So I wanted to share that because I had lowered my blood pressure before all this happened. It never really got much above 145, but I was able to drop it almost about 30 points before. So just, but I wasn't sure I could do it that quickly. I mean, we're talking here in a matter of a day. So I'm certainly going to go that approach, because even though my doctor was nice enough to order me a medication called Norvasc, it's Norvasc, there are some side effects. It may or may not happen for everyone, but there's some dizziness and lightheadedness, and she even brought up swollen ankles. Well, I already have kind of a swollen wrist, and the thought of having swollen ankles does not sound too appealing right now. So if I can do this naturally, I'm going to go for it. And if it doesn't work, then I'll get on medication just short term until I get my wrist healed more and back to normal. So I wanted to share that. The other interesting thing, when I had the discussion with my primary care doc, and it is important to keep your primary care doc apprised of other specialists, like the orthopedic specialist that I see, so she's in the loop. She asked me if I was taking NSAIDs. So again, non-steroidal anti-inflammatory drugs such as Motrin, aspirin, can actually increase your blood pressure. And I thought, well, that's really interesting. And I promised to do a little more research on this for the next episode. The other interesting thing that came up is that vitamin C can help your tissues heal. So when my orthopedic doctor who performed the surgery came back with prescriptions, again, oxycodone, I have more than that I'll probably ever need, but he also had one for vitamin C. And I thought, this is great, of course, being a nutritionist, right? And I already take vitamin C. So he had wanted me, when I was already doing this, to take 1,000 milligrams. You can do it in two tablets of 500 milligrams each. But 1,000 milligrams of vitamin C daily to help, with tissue healing. So I use Biotics Research Corporation line. I order through them for my clients, and I take their products myself. So I just went ahead and reordered the vitamin C that I already had because I was almost out. So I'm still taking my regular supplements in addition to all I'm taking that's new now is oxycodone, just one pill at night. And then this little bit of Motrin during the day. And but I'm still taking my very good probiotic. And then I'm also taking the vitamin C. And the other thing that came out was I do have osteopenia. Unfortunately, I had this probably 5 years ago before I really, for those of you who listened to the beginning of the podcast, I really had this sort of transformation with my health and my lifestyle in 2012. So unfortunately, I wish I had done it sooner because I might have been able to head off osteopenia. But it isn't osteoporosis, but it's almost there. So unfortunately, when you have that and you fall, your bones are more brittle. So, had this happened to me 30 years ago and my bones were a little bit stronger, I may or may not had this kind of fracture. But I did ask the doctor, what's the alternative if I don't go ahead with the surgery? Because when he said he was going to put a titanium plate and screws in my wrist, I was just like floored. Again, because A, I wasn't expecting it, and B, the thought of anything artificial inside of my body just was kind of frankly revolting. So he said the risk of doing nothing is that you're going to have more deformity, probably arthritis, and less mobility, less full use of my wrist. So that pretty much convinced me to proceed with the surgery. And just so you know, I asked these questions like 15 minutes before he was going to perform surgery because I was so stunned when I went to see him as an outpatient. He recommended this. I wasn't even thinking 100% clearly to ask all the questions. And that is one reason why you want to bring a friend with you. And unfortunately, my friend wasn't thinking critically at the time. She noticed that I was just I wasn't feeling great because I was already wearing the cast and dealing with the pain of the broken wrist, and I had to wait over an hour to see him. So, but doctors are required to come talk to you before they put you under before surgery. So I had made up my mind. I wrote down the stuff. I even downloaded something and pretty much from a professional orthopedic site where, they talk about their professional opinion when surgery was required. And I wanted to see that he was going to agree with that statement. So I literally was sitting there in bed, ready to be sedated with last minute questions. And he was very gracious and kind to answer everything. We talked and I grilled him still, 15 minutes. Then I was fully satisfied. So just remember, even if you have some last minute doubts before surgery, go ahead and voice them before you have the surgery so your mind is really at ease about what you're doing. Because I was maybe 95% sure when I went in, and then after I talked to him, I was definitely 100% sure. So anyway, I wanted to share all that with you. So A, why I wasn't coming out with my weekly episode last week. And B, that I will update you. I'm going to do some digging around about the vitamin C and NSAIDs a little bit more, why it maybe causes your blood pressure to go up and any other things that might impact it when you have an injury. Certainly stress can do that. And I will have seen my orthopedic specialist who did the surgery by the time we talk next Thursday, because I will see him next Wednesday, and I really hope what is going to happen is he will remove the cast, and I will have a brace that I can take on and off, and that therefore I can actually drive because I have a cast that runs from my elbow to my wrist right now, and I dare not drive with one hand, even though I'm sure I could drive around the block. I don't want to take a chance. There's so many things you do with both hands you just don't realize till you have one of them that you can't use anymore. So I am counting down the days till this happens. I hope nothing goes wrong in between. I don't mean falling, but just that it's healed well enough. So stay tuned, and I will report back to you in a week. Thanks, everyone. Have a great, healthy week.